This video is going to cover Chrome Natural, which is GuidedSMILE's FP1 design. FP1, as you may know, is a crown and bridge design of a prosthesis as opposed to a full hybrid design where you flatten the bone and have new teeth and pink, right? So this is just the teeth. More like if you were going to place implants, use custom abutments and make a roundhouse bridge. So more like that. So this patient obviously has some dental issues over the years, missing some teeth. But the reason this is ideal for an FP1 is because patient still has some nice scalloped architecture, still has bone and teeth in the anterior. And the doctor performing this surgery will just have to address number 9, add some bone, or maybe raise number 8 a little bit to match it out. But otherwise, this is a pretty ideal case for an FP1. So let's go right to the surgery because the records are typical, right? Which is the normal photographs, CT scan in open position, upper and lower STL files with a bite, pretty normal, standard GuidedSMILE records. Now, with this type of surgery, depending on the situation, a lot of times there'll be a flapless surgery, so that's an option, but most of the time it's still flapped, right? And one of the nice things about flapping is that you can see the bone architecture, so you can make adjustments, augment, add to, graft, that type of thing. It's a lot more challenging when it's a flapless surgery. So this is also per normal, where you'll make a crestal incision where there's tissue, and then you'll lay labial flap, taking the gingiva apically past the fixation base. Once the flap is completed, then you'll try in the pin guide, often with dentate, or frequently with dentate. The tissue is going to hold up the pin guide from seating the vestibule, that type of thing. So you may have to try it in after the flap is laid. Try it in, make sure that it fits perfectly. As always, check the windows to make sure it's down. Got some nice photographs here showing that it is fully seated. And then, of course, always make sure that the tissue is apical to the fixation base, right? Use a Minnesota, use other types of instruments to make sure that it's apical. And then refer back to the SurgiMat for some key information, right? In this case, it was to extract number 7 prior to placing the pin guide. All right, so I should have covered that a little bit earlier. So number 7 has to come out because a pin is going to go where the number 7 root is. And then follow this for the pin length. Short, long, long, short. In those positions right there. All right, that's very important. All right, shrink that. And then you go through the process of pinning. All right, in a maxilla, sometimes you leave the pin a little bit short and then tap in the remaining 1 millimeter or so to get good fixation, good stability. All right, pin 1 in, pin 2, and then etc. No particular order. Just drive them all the way until they meet the fixation base. And if that takes a surgical mallet and a mirror handle, please, so be it, especially in the maxilla. Let's get them all the way down to the fixation base. All right, and then release the chrome locks. All right, and then what you have exposed is the bone, teeth. In this case, these teeth are going to be hopefully atraumatically extracted because there is no bone reduction, at least not a gross bone reduction in an FP1. And as you can see here, once that flipper was removed, the tissue was laid back. The bone here looks pretty good to work with, right? Might be able to get some nice symmetry here between the centrals. Let's go through the normal process. And then at this point, you could have either used a scallop guide, which this doctor used both. All right, ordered a metal scallop guide. We've gotten quite good at making these scallops now to idealize the architecture, the bony architecture. But you can also use the prosthesis because ultimately the neck of this tooth is designed for symmetry left and right. So you can try this in. You can adjust a bone until it seats. You can adjust the prosthesis as well, a little bit in some areas, but ideally you're adjusting bone until it seats, and then you're leaving a little bit of a gap for tissue. This is suturing a flap out of the way in the lingual. So if you order the scallop guide, then you will follow it, right? So this will tell you exactly where to adjust the prosthesis, the bone, right? Like so. Round burrs until you're satisfied, and really until the prosthesis seats. And it's rare that, of course, everything is ideal. All right, osteotomy guide goes in, and then just follow the rules or the guide instructions on the surgery mat. Right, this is a Straumann case, so these are the sequence of the tools. Sorry, the tools and the settings for each particular site, and then just go through the process. I won't spend too much time on that. All right, so now all the implants are in, and in the FP1 situation, there is no carrier guide. It will not fit because there's bone. So instead, just place your temp cylinders, add the gaskets, seat the prosthesis, all right, and then just simply backfill with the stellar material. And just use a little bit of caution so you don't express too much material, right? You don't want to get anything around these abutments. But these block out gaskets work really well. So backfill, take it back in the laboratory, adjust, right? Adjust until the metal is reduced down. And then in this case, the doctor and the lab tech added a little bit apically to the prosthesis just to fill the gaps during some healing. Just a little composite here, or a little stellar probably. And really did a nice job. All right, a little bit of healing completed there. And then they did not pick up all the implants. They'll come back later, but the implants are in nicely, and they're also indexed on the rapid appliance. So that'll make it easy to convert to final. And, even though the adjustment really flattened out the occlusion, that's okay. It's probably better that this is not, perfect occlusion. And it's nice. It's nice because the patient can hit and slide, move around during healing. But this would be probably an ideal case for C2F, where these could all be small holes as well. So you really have both choices. And then patient came back into temp a few weeks later, and really a nice result. All right, so that is an FP1 chrome natural.